Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have an exciting session with Dr. Jayakumar. Dr. Jayakumar, thank you so much for joining. And on that note, the floor is yours to take away.
Thank you, guys. Thank you. Before I start the session today, I want to congratulate Dental Shadowers for creating this platform for continuous learning, especially during this unprecedented times. I know when I completed my BDS or when I was doing my BDS, I never had any opportunity to shadow anyone from abroad. So this is definitely a great opportunity for learning, but at the same time, it's a great opportunity for me to spread awareness on forensic odontology itself. So thank you, guys. Thank you for inviting me as well. So before we go into the session itself, a little about myself. So I'm from India, but I was born and brought up in Dubai and Muscat. I did my dentistry in India in AB Shetty Memorial Institute of Dental Sciences, after which I did my internship and residency as well. I did my specialization. Before doing my specialization, I did a studentship in France as well, which was definitely a unique experience. And that is how I decided that I'll do my master's in the UK as well. So I did my specialization in forensic odontology in University of Dundee, Scotland, UK, after which I wanted to diversify my knowledge in forensics. So I did a diploma as well in forensic archaeology and anthropology in Durham University, England, UK. Currently, I'm a prospective PhD candidate for University of Dundee, Scotland as well. Now, why did I choose forensic dentistry, or why forensic dentistry? I chose forensic odontology just because of my interest in research and forensics within dentistry. I thought it was really fascinating. It was really interesting. We did have a small, not module, like a lecture of sorts on forensic odontology. I was absolutely fascinated by it. And that made me choose forensic odontology as my master's. But I had no idea how to go about it. And at the time, forensic odontology was not popular as well. And even now, it's not quite popular in so many countries around the world. So I had to do my Google research, and I found out that forensic odontology was taught as a master's only in 3 countries all over the world, and that is Belgium, Australia, and the UK. I didn't choose Belgium because they did not teach the course in English. So it was between Australia and UK. But comparatively, UK had better scholarships, better school rankings, and it was definitely more affordable with the scholarships, of course. So I decided to choose UK. And within the UK, why University of Dundee? Definitely the dental school rankings and the forensic school rankings, because as you would know, forensic dentistry is 2 subjects together, is forensics and dentistry. So the dental school and the forensic school rankings did definitely matter when it comes to your CV as well in the future. So the dental school, University of Dundee, was ranked #1 when I joined in the UK. And similarly, Dundee also topped the top 10 graduate prospects in forensic school as well. Also for the fact that they had such a unique forensic odontology master's course. It had a great foundation with subjects like forensic science, forensic medicine, archaeology, anthropology. We even had forensic law because you will be working as an expert witness in court. So you should know how to deal with lawyers and the judges and stuff like that. So we had such a great foundation to build our forensic dentistry on, especially, and it made the transition from dentistry, forensic dentistry easier as well. Also for the fact that we had supportive staff, the course itself was very tailor cut and specific to the students' needs. So we could pick what we wanted to do as well. So it was such a unique dentistry specialization as well. We also had autopsies, we had hands-on experience, we could work with the police, write police reports. So it was such a well-organized course as well. Also for the fact that the university was awarded University of the Year for student experience in the UK as well for quite a few years now, especially because Dundee has quite a few societies where you can find your own community. And at the same time, there were so many award ceremonies, events and whatnot, of course, before COVID. They also have a great mental health support system, which all made University of Dundee such a great experience for students. Also, the city itself, Dundee is a very beautiful, calm city compared to the busy Edinburgh or Glasgow, which is something that I personally enjoy, but also for the fact that I, as an international student, as a person of color, I had to make sure that I was going to a community where I'm welcome. So And I can say Scotland and Scottish people are such a warm and welcoming community. So that was also one of the reasons that I chose University of Dundee. So yeah, these are quite a few reasons that I chose University of Dundee and forensic dentistry. Advice for pre-dental and dental students. So I'm going to divide this into students who are interested in taking up forensic odontology as a career option, and for the ones who are just curious about the subject, but they don't really want to take it as a career option. So for the ones who are interested in forensic odontology, definitely focus on your interest. End of the day, you're working for something that you're passionate about, and I think that's personally very rewarding. But when I say that, at the same time, I need to see about research and its struggles. So dentistry is definitely an academic subject that requires a lot of patience, a lot of discipline, a lot of reading, academic writing, clinical work. But research in dentistry itself is just twice the amount of patience, twice the amount of discipline, reading and academic writing and all of that. And even when you graduate, you're probably going to struggle than a dentist who's looking for work because it's research work, you'll probably struggle with finding funding for your research or even finding a full-time job in the beginning. But when you know that your research study is going to make a huge difference in dental history, you're basically leaving a mark in dental history with your research study, and there are going to be other dentists and dental students looking up to your research and making changes in their clinical practice. I think that personally for me is quite rewarding, and it definitely differs from one person to another, but research definitely has its struggles. But personally for me, it's been quite rewarding. Another advice would be reach out to other forensic dentists. Now, the difference between a forensic dentist and any other specialty dentist is you can go onto a social media platform if you're a dentist or a specialty dentist, or orthodontist, prosthodontist, endodontist. You can go onto social media platforms and actually share your work. But as forensic dentists, you cannot do that. You cannot do a TikTok dance on someone's autopsy or death or an assault case. It's basically something criminal cases that you're going to be handling. So you can't go on a social media platform and actually share your experience because there's a lot of confidentiality agreements that you'll be signing. And of course, for the fact that it can cause a trigger response in the audience that's actually seeing this content. But even if they don't have a huge following, or even if they don't have a professional account, it's only because we can't do that. But you're still free to reach out to them on LinkedIn, Facebook, even Instagram. You can, I'm pretty sure they're going to guide you and help you out if you're interested in the subject. Another thing that that's not quite talked about is dealing with death and decay, especially because as dentists or as dental students, we're not taught how to deal with death compared to medical students who have forensic medicine as a module. So for them, it's easier to take up forensic medicine because there is a module in their undergrad degree where they can know what forensic medicine is like or autopsies are like. But for dentistry, we don't have that sort of practice, or we're not prepared to handle death because we always deal with live patients. So that transition from dentistry to forensic dentistry is something that you need to be prepared about when you choose forensic dentistry, because I know a lot of a few of my batchmates or even colleagues that I know of took the forensic dentistry as their masters, but then they realized that they could not handle death or decay or decomposition, and they had to leave the course itself. So this is something that you need to be prepared about, and this is something that's not quite talked often about as well. Another thing that's not talked about much in forensic dentistry is definitely mental health. There is a stereotype among forensic professionals that they actually have substance abuse issues because you handle death and decay and all these negative things. It affects your personal life as well. So they find a medium, which is sometimes alcohol or smoking or even drugs, to sort of disconnect yourself from your professional life. But I can vouch for this, that this is not true. As a person who's diagnosed with generalized anxiety disorder and mental health issues, you can find a healthy medium to disconnect yourself from professional and personal life. But this is very important as a forensic professional as well. Because as a forensic dentist, you're not just a dental professional, you're a forensic professional as well. And this is really important for you to disconnect from your work and your personal life. For the ones who are not interested in forensic odontology as a career option, as dentists or even dental hygienists, assistants, there are so many ways you can help your or support your forensic odontology colleagues, especially with your dental records and findings and x-rays, which we'll be discussing about this further in the next few slides. But yes, even if you don't take up forensic odontology as your career option, there are so many ways where you can help other forensic odontologists with your dental charts and dental findings. And before we start the main content of today's session, I'm just gonna repeat this. This is more like a trigger warning where the presentation is definitely going to contain triggering and or sensitive material. I'm going to discuss about death, decomposition, human remains, sexual violence, rape, sexual assault, and abuse. If you may feel triggered, you're more than free to take a break and come back or leave the session as well. Also, the fact that I'm requesting you guys not to take any screenshots or images and share it on social media platforms, because for me to use these case reports, I actually had to take ethical clarification, like ethical permissions from the police in the UK as well. So this is just for academic purposes. So I request you guys not to share any of these information outside. And thank you in advance. So I'll go to the main topic for today. So I'm going to be introducing forensic odontology as a subject. I'm going to introduce what forensic odontology is, why we need forensic odontology, primary roles of the forensic ontologist, some famous cases as well. Then we're going to look into what a dental autopsy is, more like a small overview of what happens in the mortuary, and then the research aspect of today's topic, how we use dental anomalies to identify a person. And I'm going to introduce an atlas that I created after the research, which can be helpful for dental students as well. So forensic odontology, by definition, by the Fédération Dentaire Internationale, is defined as the branch of dentistry which, in the interest of justice, deals with the proper handling and examination of dental evidence and with the proper evaluation and presentation of dental findings. Now, why do we need forensic odontology? So we can agree to the fact that identifying someone is defined as determining one's individuality. And now this, in most of the countries, comes from DNA and fingerprints. Now, in identical twins who share the same DNA, fingerprints definitely hold an upper hand. But in some cases, you tend not to get fingerprints like major fires, decay, decomposition, even extensive cases of trauma. You tend not to get fingerprints. And this is where teeth comes into picture. So teeth not only provides individuality to a person, but it's also durable and they're highly resistant to damage as well. And this is one of the reasons why, even in mass fatalities, it's considered to be one of the easiest, reliable, and economical method of identification, because you would know DNA and fingerprints, they definitely are complicated. They have extensive databases and softwares, and they're expensive and time-consuming as well compared to identifying someone using dental information. Now, what do a forensic ontologist do? So a major chunk of our work is basically human identification, and that is also a major portion of today's topic as well. But something else that we do is age estimation. So age estimation, we do estimate age for children, adolescents, adults. There are several ways of doing it. There is chemical, radiographical, visual method of age estimation as well. But at the same time, this is done for legal purposes. So you'd want to estimate the age for the accused or the victim in a particular crime, because in several countries, the punishment differs for a minor and for an adult. So it's important to estimate age before you know what crime they're accused of. And in countries like the UK, we welcome refugees from all over the world. And the benefits for the refugee status differs for a minor and an adult. So it's important to estimate the age for the refugees as well, so that you know where to put them or what benefits they have in the country. So these are some of the reasons why we do age estimation. Another thing that we do is definitely bite mark analysis. Bite mark analysis is a very um, sensitive topic when it comes to forensic odontology, mainly because there have been several wrong convictions in the past that used bite mark analysis, especially in the US. So this is quite tarnished the name of forensic odontology, but bite marks as well. Bite mark analysis is also one of the things that forensic odontologists do. Another thing that we do is disaster victim identification. So this definitely depends on how bad the disaster is and the number of victims involved in the disaster. So this is basically identifying every victim of that particular disaster. So you could be allocated anywhere in the world, and it can be physically strenuous because you're going to be working for days together during the disaster as well. And it can sometimes take a toll on your mental health because you're surrounded by death and all the negative attributes of death as well for days together. But yes, DVI or disaster victim identification is also something that we do. Another thing that we do is identification of dental or medical legal fraudulence. This is more of a corporate aspect of forensic odontology, and this is mostly used for insurance purposes, where you identify if the treatment was absolutely necessary for the patient or if it was done for the personal or financial benefits of the dentist. As I said, this is more of a corporate legal aspect of forensic dentistry. And of course, there's a research and teaching aspect of forensic dentistry, just like any other subject. There, you can also work as an expert witness. That is, you would go to court and submit your evidence. And these cases can range from anything from identification, age estimation, rape cases, child abuse, domestic abuse. So it can range from anything. So yeah, these are some of the roles of a forensic odontologist. Now we're going to look at some of the famous landmark cases of forensic odontology from around the world. So the first ever documented case of forensic odontology happened around 2000 years ago in the Roman Empire. So Roman Emperor Claudius, his second wife Agrippina ordered her soldiers to kill his first wife, Lolia Paulina, and the soldiers severed Lolia Paulina's head, brought it back to Agrippina, and Agrippina identified Lolia Paulina using her dental alignment and certain distinctive characteristics of her dentition. So this is the first recorded use of dental identification that we know of. Another famous case is of Adolf Hitler. We all know after the World War II, Adolf Hitler and his wife committed suicide. The Russian forces did get their remains, which was a lower jaw and partial skull fragments, but their autopsies were inconclusive. It was 23 years later, Hitler's dentist identified these remains as that of Hitler's, using the 9-unit dental bridge, as you can see in the images. And this is how his identity was confirmed as well. Another famous case is the Ted Bundy or Theodore Bundy. He was an American serial killer in the 1970s who was responsible for the rape and murder of more than 30 young women. Out of his victims, one of his last victims, Lisa Levy, was bitten by the attacker, but she got to get away. It was followed by where Ted Bundy was forced to submit a dental examination, as you can see, and it was concluded that the bite marks on Lisa Levy's body matched his dental impression. And this was the first recorded time in Florida's history where a case definitely relied on bite marks or forensic odontology as its major evidence. If you're interested in watching this, there's also a docuseries on Netflix called Conversations with the Killer, the Ted Bundy tapes, where they actually explore how the dental examination was used against him in his case as well. Now, there was also a movie, of course, that's called Extremely Wicked, Shockingly Evil and Vile, which is played by Zac Efron, that also talks about Ted Bundy's life. From a DVI perspective or a disaster victim identification perspective, two of the major disasters that used forensic odontology were the World Trade Center disaster and the tsunami disaster. So during the World Trade Center disaster in 2001, at least 501 victims were identified by dental comparison. Similarly, in 2004 in Australia and even in Thailand, it was forensic odontology that contributed to around 70 to 80% of its identification as well. So yeah, these are the two major disasters that used forensic odontology for the identification as well. So those are the few famous cases. Now we're moving to dental autopsy, or what forensic odontologists do in a mortuary. So we definitely start off with our initial preparation, just like any other dental surgery. So we definitely wear our PPE. It's preferred that two dentists do the autopsy, so that we assign a dirty dentist and a clean dentist. So the clean dentist is going to be the one who's going to do the charting, who's going to be doing the writing part of the autopsy. The dirty dentist, as the name suggests, it's going to be the one who's going to get their hands dirty. And we have two forms, the AM form and the PM form, which is ante-mortem form and post-mortem form. The AM form is the yellow form, the PM is the pink form. We're going to use the pink form first for the autopsy, and then the AM form later. Now, definitely there's the oral prep or the dental prep, and this is basically gaining access to the teeth. This is a body that we retrieved from the river in Dundee, and that is why you can see that the eyes are missing. And this is one of the PM artifacts that happen to a body that is immersed in water. So we need to gain access to teeth. So most of the times it's easy. You can just pry open the mouth with some force and you get access to the teeth. But in certain cases, such as rigor mortis is another PM artifact where your muscles stay in a constricted form. That is when you have difficulty in prying open the mouth. And this is only when, and this is mostly like a last measure where you use an incision to gain access to the teeth. And the incision is from the angle of the mouth to the tragus of the ear, so from here to here, and then you open up the flaps, do the autopsy, and then you stitch them up. But the thing is, again, this is the last measure when it comes to gaining access to the teeth, because you're making this incision on the face, which is something that we try and avoid for the autopsy. Now, once you gain access to the teeth, you need to clean the oral cavity using a gauze, because you never know where you get the body from. It could be from the water, it could be from 6 feet under, it could be from anywhere. So there could be maggots, there could be dirt, there could be worms crawling out of the mouth. So you definitely need to clean the dental area before you start your autopsy for better visibility and access. Then you'll start your PM recordings, and this differs from one country to another. In the UK, we use a dental chart which looks like this, and you start your dental charting from the first quadrant to the fourth quadrant according to the FDI notation, so you go quadrant-wise as well. After your PM charting, you take radiographs, and most of the mortuaries or forensic odontologists have a portable X-ray machine, as you can see in the image. And again, the radiographs that are mostly taken are periapicals or bite wings, and they're taken quadrant-wise as well. After which you take photographs. Now, the thing with photographs is sometimes you might have to identify someone just with a skull or a mandible, as you saw in case of Adolf Hitler. What they got were skull fragments. And sometimes you get a whole body to do an autopsy on. When it is fragments, you use something called as an ABFO scale, which is the American Board of Forensic Odontology scale, as you can see in the picture. You use this scale because later when you work with these photographs, you'll have a measurement scale to work with later on. So you use an ABFO scale if it's fragments. But if you get a full body to do an autopsy, you would take photographs just like how you would take for your patients. So you take an anterior photograph, right buccal, left buccal, maxillary occlusal, and mandibular occlusal. And you can use retractors and mirrors while you take these images as well. So after your PM recording, this is something which is a part of the autopsy process, but we don't do it as forensic dentists. This is mostly done by the police. So this is ante-mortem data collection. But your AM data is anything that gives you information on your dental status. So it could be dental records, x-rays, photos, charts, even dental appliances, study models, and casts. So anything that gives you information of someone's dental status is AM data. Now, as I said, this is done by the police, and this is one of the reasons why we take this session for police training as well. And we've also given the session for the Scottish Police in Dundee, because then they would know what can be collected as AM data. Now, once we have the PM form filled and the AM data, which could be charts, photos, anything, we transfer it to the AM form, the yellow form, as I mentioned before, and then you start your comparative analysis. Now, one of the reasons why we do PM first and then AM is to reduce bias. Because if you see the AM data first, you tend to subconsciously match your data while doing the autopsy. To reduce this kind of bias, you do the PM first and then you do the AM and then you try and match, try and do a comparative analysis. Now, your comparative analysis leads to one of the four conclusions as per the ABFO terminology. So one is positive identification, where you say, oh, this is Mr. X. Another one is possible identification, where you say, this could be Mr. X, but there are inconsistencies that are explainable. Another one is insufficient evidence. When you don't have enough AM data to come to a conclusion, you put insufficient evidence. The last is exclusion, where you say, oh, this is not Mr. X. So these are the four conclusions. After which you're going to be writing the report. The report is one of the most important parts of the autopsy, because you can do an autopsy in 93, 95, but your report is going to stay forever. So report is one of the most important steps of the autopsy. So it definitely, the first 2 pages contain the case details, case number, the qualification of the forensic dentist to do the autopsy, chronology, so who called you for the autopsy, what day was it done, where was it done, what were the instruments that you used, did you take radiographs, photographs. So it's basically more like a chronology of events. And then you have the summary of findings, and of course the conclusion, where you say, oh, this is or is not Mr. X. So this is your first 2 pages of the report. And of course you need to provide evidence to how you came to the conclusion. So you put dental charts, the comparative analysis. There needs to be a glossary in the autopsy report. Why? Because the autopsy report is not only going to be handled by dentists, it's going to go to police officers, it's going to go to lawyers, even judges. So the glossary will give them an idea of what a mesial surface is, a lingual surface is, or a buccal surface is, because they wouldn't know these terminologies. So it is important for you to put a glossary in the autopsy report as well. Then, of course, there are radiographs, the inference of the radiographs, and the photographs in its description as well. Now moving on to the research part of today's topic, the role of dental anomalies in human identification. So how we can use dental anomalies or dental features to identify someone. So forensic odontology, especially from an ID perspective or identification perspective, is based on the foundation that every individual has a unique dentition. Now, this uniqueness comes from dental features or dental anomalies. So dental features such as missing teeth, filling, crowns, dental anomalies such as rotated tooth, additional cusps, spacing, crowding, etc. So any of these features can give the uniqueness to dental, dentition of a person. Now, in my research, what I wanted to check was I wanted to evaluate the awareness regarding the forensic value of recording these dental anomalies among dentists in South India. So I basically conducted an online survey-based study on 101 dentists in South India. The survey basically had 4 sections. The first section was based on the participants' background, years of experience, state in which they're practicing. The second section was a dental charting task, which I'll be discussing in the next slide. The section 3 had questions on attitude of charting dental anomalies and recording these anomalies irrespective of patient's chief complaint. Section 4 was questions based on dental record maintenance and a basic awareness on forensic odontology. Now coming to section 2, the dental charting task. So this was a photoshopped image that I gave them, where there are quite a few dental anomalies, as you can see. And I gave them 24 options to choose for each tooth. And I also gave them an additional space where they can put findings such as spacing, crowding, attrition, stains, calculus, etc. Now, after the research study itself, the results from section 1 and section 2 were quite disappointing, but it was quite expected as well. It was seen that majority of the participants overlooked very obvious anomalies. They overlooked misnamed and or incorrectly recorded dental anomalies, especially obvious anomalies such as midline diastema and crowding. Even anomalies such as axillary cusp was misnamed, and even transposition was overlooked. But from section 3 and section 4, the results were quite promising. It was seen that a majority of the participants understood how recording every single anomaly or dental feature was important and how it helped in identifying someone. But from the dental charting task, it was seen that it was never put into practice. And this is one of the reasons why I gave them the dental charting task. Because if you ask a participant, oh, do you do accurate dental charting? They're always going to say yes. But it's from the dental charting task that you can see that they don't really put their works into practice. It was also quite promising to see that they had an awareness on what forensic odontology was and how they maintain dental records, which could be used for forensic odontology as well. So from the study, we concluded that there was an increased awareness of forensic odontology among Indian dentists, but there was a lack of awareness on how their dental recording is going to affect forensic odontology. Now, here I'm going to share a case study with you. So this was an autopsy done in 2019. So it was a completely decayed body. The lower jaw had no teeth whatsoever. The upper jaw had 4 teeth that I could work with, but it was only these 4 teeth, as you can see in the image, that we could use for the dental autopsy. So we basically had to identify someone using these 4 teeth. Now, this was an image taken in 1995, and I want you guys to focus on this rotated tooth, or distally rotated tooth, and it was this single tooth, of course, with other radiographic features, that helped in identifying this person. So from this case study alone, or from this autopsy alone, we can understand, we can see how every single dental feature or anomaly can help in identifying someone as long as they're recorded in the AM data. And as I said, this AM data could be anything. It could be dental charts, photos, radiographs, anything. But as long as they're recorded accurately in the AM data, even a single rotated tooth can be used for identifying someone. Now, to understand that further, so to understand this further, I created something called as a scale of forensic significance of dental features. This scale had 3 parameters: incorrect, partially correct, and accurate. And we're going to take 1, 2. So we're going to take 2, 5 out of the dental charting task that I gave them, which had an axillary cusp. So for the participants who mentioned axillary cusp, this finding is absolutely right, and this will help me with my positive identification. For the ones who wrote partially correct, say talons cusp or sound. So I had participants who said talons cusp instead of axillary cusp. Now these answers can be considered as partially correct. Why? Because in my dental autopsy report, I can explain this inconsistency as a possible dental charting error. Maybe the dentist misnamed the anomaly, or maybe the dentist thought the axillary cusp was something that did not require treatment, so it was sound. So as long as I can explain this inconsistency, it's just a minor error. It still does not throw me off of my path of my autopsy. But I also had participants who mentioned torodont, which is the wrong answer and it's a wrong finding. Now, this can definitely throw me off of my path of my autopsy, and it could lead me to exclusion, which is a wrong conclusion. For example, I might have Mr. X on my autopsy table, and because of several incorrect recording, I'm going to come to the conclusion that this is not Mr. X. But at the same time, it might be Mr. X's family standing out of the mortuary waiting to know if it's their loved one. So this is one of the reasons I believe forensic dentistry, or understanding this part of forensic dentistry, is a matter of life as well, because you're identifying a human being end of the day. So this is how one incorrect finding or several incorrect findings can lead to wrong conclusion. Now, this is one of the reasons why I created the Atlas, or the Atlas of Dental Anomalies. So I created it to be used as a study material for dental students. It can be a checklist for dental nurses, hygienists, assistants, because they do dental charting as well. It can also be used as a reference material for dentists, because you can, misname or even forget the terminologies of certain anomalies as well. It can also be used by the police, lawyers, or layperson as a reference material as well. So the Atlas of Dental Anomalies is actually a digital atlas, but this is more like a PDF version of the atlas. And you can get the PDF version by accessing the QR code on the screen. If you'd like to take a screenshot, you can take a screenshot as well. But the digital atlas itself can be accessed at www.theatlasofdentalanomalies.com. I'm going to show you the atlas just now. So this is the website. So there's a small description of how to use it and why we created it. And this is the atlas. So if you'd like to look at an anomaly, say that looks like this, you can click onto that particular anomaly. It shows you a small description and what it looks like, of course. But if you want to look into a terminology, then say, for example, you want to know what a Hutchinson's incisor is, you can click on the terminology as well, and it'll do the same thing and show you how the anomaly looks like. I've also included positional anomalies, as I said, midline diastema and crowding were positional anomalies that were overlooked. I've also put root-related anomalies and also pulp-related anomalies and their radiographic features to understand how they would look like on a radiograph. You can also have the PDF version of the atlas here as well. It will do the same thing. And this is the team that created it. So that's myself, my supervisor, and we also had a medical artist to create the digital atlas. There is also a Let's Chat box where you can put in your queries in the future, and it will be directed to me, and I can answer the questions for you later on. So that's the atlas. Now to conclude, we saw that identification by teeth is considered to be one of the easiest, reliable, and economical method of identification. But in several countries, it's still not used to its potential. We saw from the research study that the awareness on forensic odontology among dentists in certain countries are exceptional, but the charting of dental anomalies was poor. We saw from the case study that even a single feature or dental anomaly can help in identifying someone as long as they're recorded accurately in AM data that could range from dental charts, photos, radiographs, casts, anything. We also saw the Atlas of Dental Anomalies and the scale of forensic significance of dental features. These were designed to create better, reliable, and up-to-date dental records that can be used for human identification purposes in the future. Now, if you'd like to read about this further, I've also published an article in the name, The Role of Charting Dental Anomalies in Human Identification. It's a free article. It's published on Forensic Science International Reports. You can read more about it as well in the article. And that's me. Thank you so much for listening. If you have any queries, I'm more than happy to answer them now, but if you have any queries in the future, you can direct them to j.jayakumar@dundee.ac.uk.
Thank you so much, Dr. Jayakumar. That was an amazing session. So Kathleen is now going to read some questions that we had in the YouTube chat. If that's okay with you.
Okay, yeah, sure, no worries.
Great. So our first question is, all right. Are wages significantly different for a forensic dentist versus a general dentist?
It definitely is. So forensic dentistry is still a research subject. So it's more like, say, oral biology or oral pathology. So it's more of a research subject. So your line of work is also going to be different. So it's not always hands-on. You have to work in a lab, you have to work for a university sometimes, but at the same time, you can go to clinics and work as well and choose forensic dentistry more like a side hustle. But if you're looking as a full-time job in dentistry, it's more of an academic subject. So you'll be working in more teaching and research fields than sitting in a clinic and working. So of course, the wages are absolutely different.
What are the working hours in forensic odontology like?
So if you're in a teaching field, it's definitely 9 to 5 or whenever universities are open, because it definitely runs according to how universities are open. So here it's 9 to 5, so 9 to 5. But again, it depends because the police might call you, or if you're affiliated to a mortuary, or they might call you even during a weekend saying, oh, we found a body from this particular site. Can you come over and do an autopsy? And the autopsy can range from 2 to 4 or 2 to 3 hours tops. So it's more like an on-call thing when it comes to autopsies. But if it's a teaching field, as I said, it's more like a 9 to 5 job. You teach, come back, you do your research work, come back by 5. It's more strictly from this time to this time. But as I said, if it's an autopsy, the police can call you anytime, any day, and you might have to pop in and do the autopsy.
Can a foreign trained dentist do forensic ontology?
Yeah, of course. As long as you have a dental degree, you can do forensic dentistry. And I'm not quite sure how it is in the US though, but in the UK, if you have a dental degree, you can take up forensic odontology and then you do a licensing exam and then you can start practicing as well.
Okay, cool. What's your favorite part about the profession?
Oh, wow. This might sound a little odd, but I definitely enjoy doing autopsies. I know it's a lot of death and decay and all of that, but it's quite of a Sherlock Holmes vibes. I think it's such an odd thing to say, but it's very fascinating in a way that it feels like you're solving crime, you're identifying someone. And if it's an assault case, you're finding the perpetrators, you're finding who did it, if the accused or the suspect is actually the one who did it, especially in bite mark analysis cases, as you saw in case of Ted Bundy. You can even catch serial killers using bite mark analysis. So it's very fascinating. So I think autopsy is definitely something that I enjoy doing, although it's such an odd thing to say. But yeah, it is what it is. Yeah.
That's cool. It's unique. What would you say was the hardest part about dental school?
Dental school. So this is my undergrad dental school, you mean, or is it my specialization?
Your specialization, sorry.
Okay, no, okay, specialization was definitely the transition. As I said, we're never prepared as dentists to handle death or decayed bodies or autopsies per se. So to sort of be mentally prepared to see those kind of cases. We also had like case reports of sexual abuse in children where we had to analyze bite marks on a 4-year-old's body. These are things that you're not prepared for as a dentist. You see blood, of course, you do surgeries, of course, but stuff like this can hit you in a certain way. So I think that is something that I found was difficult in the beginning, but then I think you sort of train your mind not to be personally involved in these cases and emotionally invested in these cases, because then it will definitely take a toll on your professional and sometimes your personal life. So I think that was something that I thought was difficult in forensic dentistry.
Yeah. If you were not practicing forensic odontology, what would you be practicing?
I was always interested in maxillofacial surgery. Yeah, I think if not for forensic dentistry, I would choose oral and maxillofacial surgery. I still find it fascinating. I still attend conferences just to see what's happening and all of that. But yeah, if not for forensic dentistry, definitely oral and maxillofacial surgery.
Are you required to go to some sort of therapy or do mental health checkups, or are they optional?
They're optional, but after DVI, so I'm working for an organization called Kenyan International Emergency Services. So what they do is they have offices all around the world. So I'm working for the office in UK and the US as well. So they would allocate me to a disaster site after the disaster, and you work, you identify victims, and you come back. But after coming back, there is a compulsory mental health check. And if you want to go to therapy, they'll find resources and sources for therapy as well. But after DVI, I think it's compulsory to get a mental health check done, or otherwise it's just optional.
How do you balance work and family life?
family life per se, I'm with my partner, so I don't have an extensive family. The family is just 2 people. But for me, it's just disconnecting. And I know I mentioned before, for a lot of people, disconnecting is sometimes substance abuse, which is not probably the healthiest way to go about it. My disconnection is just distracting myself from something. So anything from watching a movie with my partner, going out for dinner, anything that disconnects you from work helps me with disconnecting from forensic dentistry itself. But I also tend to, which is not a good thing to do, but I'll be honest, I tend to discuss certain cases with my partner, which isn't nice, but I tend to do that as well because I'm quite passionate about the subject, but it's better not to drag work home, especially something like this work, which
Right.
contains stuff like this.
What do you find the most challenging about your profession?
I think the mental health aspect of it. If you're prepared to handle autopsies, I've seen my colleagues struggle with autopsies itself because it can be a little gory and tackling decayed bodies and stuff like that. But for me personally, I think it was the mental health aspect of it because, as I mentioned, I've been diagnosed with mental health issues in my past. So for me, I needed to be strictly in a healthy mental health regime so that I don't fall back to anything bad that would affect my professional life. Sorry about the ambulance. Sorry.
It's okay.
So yeah, I think that would probably be the most difficult part for me personally when it came to forensic.
Okay. What gets you excited about coming into work every day?
I think it would be the case because every day is a different case and it's a different, it differs from case to case. It could be age estimation, it could be bite mark analysis, it could be an autopsy, but even in autopsies, it could be a body retrieved from this particular area. It is decayed, it's submerged, it's half decayed. Maybe it's just a skeleton, maybe it's just fragments, just skulls. So it's quite exciting for the fact that you don't know what you're going to be doing for the day. And I sort of find that fascinating. For people who like a strict regime, I think it wouldn't be that fascinating. But for me, no, it's personally very interesting for the fact that it's an adventure every day.
What is the role of interprofessional healthcare in your work?
Interprofessional. So because I said that forensic dentistry is forensics and dentistry, you, as a dentist, even as a dentist, you might have to work with forensic scientists because say, for example, you retrieve a skeleton from an area that has mud samples, then the forensic scientist is going to retrieve those mud samples from the skeleton. So you need to wait for them to finish taking those mud samples and then you do the autopsy. So you need to work with the forensic scientist in the same case. At the same time, there are medical autopsies, the full body autopsies that are done by forensic pathologists or forensic medical professionals. So you need to work with them as well. So I think at least in the mortuary here, we need to schedule the dental autopsy and the medical autopsy and with the doctors there as well. So that is one way of working. We also work with other police officers because they would come and work with us for the autopsy reports, and they will ask for our conclusion and how we came to the conclusion. We work with lawyers because when we handle a case in court, we need to explain to lawyers what forensic dentology is, which is quite crazy because it's easy to tell a dentist what forensic odontology is, but it's quite hard to explain it to someone from a very different profession. So we work with lawyers as well before we go to court and submit our evidence. We work with other dentists, of course, because we retrieve our AM data charts from dental clinics in the vicinity. So we need to work with dentists, orthodontists, prosthodontists, any specialty dentists, because we're using their data for our autopsy. So I think there's a lot of interconnection with so many subjects when you work as a forensic dentist.
Do you participate in any community service?
I used to. Before coming to the UK, I did a lot of community service in India. So I worked in a lot of rural camps where you spread awareness on oral health and oral cancer, do treatment camps, oral hygiene checkup camps in schools and villages where they're less privileged to come to a dental clinic. And it's more like a free treatment camp because they wouldn't be able to afford it as well. So I've done quite a lot of community service when I was back home. But here, no, I've not had the chance to do any community service just yet.
How did you decide that you wanted to go into forensics?
It was definitely just interest. I think it was final year of my dental school where under oral pathology, we had a small chapter called Forensic Odontology. It was Schaefer's. It was just a 1 hour lecture, but I was like, wow, that's interesting. That's something that I want to look into. And I've also always been interested in the research aspect of dentistry, even as an undergrad. But I never got an opportunity to completely get into it because dental school itself, I mean, you guys would know, is quite demanding. So and stressful. So I didn't have the time to invest in research per se. But I've always been interested in a research subject, and forensics was just absolutely fascinating to me. And that's how I took it up.
Interesting. What would you say, how's like the cooperation between you and like the law enforcement on like a typical day?
So it definitely starts with them contacting us. So every autopsy procedure, as I said, there's a chronology of events. So they would call a forensic odontologist that's affiliated to, say, for example, in Dundee, there's the police station that is affiliated to the University of Dundee. So they would call a forensic odontologist from the department and whoever is free. So it definitely starts off with them. So we get a call from the mortuary saying, okay, we have a body retrieved from this. Can you come and do an autopsy? So it definitely, the whole thing starts with them and in a way ends with them, because once we write the autopsy report, we give it back to the police station, and then they handle the family, and they report it to the family. Okay, this person from your family we've retrieved the body, and stuff like that. So there's a lot of cooperation with the law enforcement for us to work. And yeah, I think it's majorly them and also forensic pathologists who do the medical autopsy. Yeah.
What can dental assistants do to become more involved in forensic dentistry? How can they contribute?
Did you say dental students or
Dental assistants?
Assistants? I think again, it depends. In certain countries, dental assistants do dental charting, and in certain countries, they're not allowed to. So as long as you do dental charting, indirectly or directly, you're helping a forensic dentist. Dental hygienists, assistants, even dental students who do dental charting, they can always help a forensic odontologist by accurately recording dental features, even if it requires treatment or not. Like some patients come with a rotated tooth, which is slightly rotated, and they're probably not too fussed about it. They probably don't want to even fix it. But as someone who does dental charting, it's your responsibility to chart it anyway into the dental file, because it is part of that person's dental information, which we can use to identify them in the future. So as dental assistants, if they do charting, what they can do to help is provide accurate dental records and do proper, thorough red dental charting. That's the best they can do.
Do you believe that forensic odontology has a positive growth outlook?
It's still not a popular subject in so many countries. So that is one of the reasons why I'm quite passionate about actually creating that awareness, especially among dental students, so that they know, or there is a specialty like this. But in India, it's definitely gaining a lot of popularity. In UK, it's It's an established specialty. It's one of the most important specialties in forensics because in the UK, the primary identifiers are DNA, fingerprints, and teeth. So forensic dentistry is a fixed specialty in the UK and in Australia and Belgium and some of the European countries as well. But I think, especially in third world countries, in Southeast Asia, Africa, even in the Middle East, it's only gaining popularity. In the US, in the past, forensic odontology was used quite irresponsibly, as I mentioned, for bite mark analysis in the past, which tarnished its name in the US. So forensic odontology is sort of looked down upon when it comes to bite mark analysis because it caused a lot of wrong convictions in the past. If you'd like to read about it, there's something called as the Innocence Project that tackles this issue. So in the US as well, there's a tarnished name for forensic odontology, but it is not the same anymore because forensic odontology is advanced in so many ways. There's so many softwares that do bite mark analysis. It's not manual anymore. So, but yeah, it's definitely having a lot of growth potential in so many countries as well. Yeah.
That's great. How do you think that pre-dental students can work towards becoming a forensic odontology? Should we like work in that in dental school, or is there anything we can do since now?
Again, it differs. I'm not quite sure how it works in the US, but as pre-dental students, at least in the UK or in India, I know you can take up a lot of research opportunities with a forensic dentist, or even oral pathologists who take up forensic dentistry research. You can definitely start off with research, but I don't think you can get any hands-on experience as pre-dental students because I don't think it'll be safe, especially mentally, to expose someone to autopsies right away without having any knowledge about anatomy, physiology, and all of that. So I don't know if it's safe enough to put them in a mortuary and show a decayed dead body and be like, yeah, this is what we do. I think I think that'll probably scare them more than actually taking up the subject. But you can definitely take up research work and even maybe voluntary work. But again, I don't know if I'll put a student in a disaster victim identification scenario.
It would probably be research.
So mainly they can start off with research and reading about it rather than jumping into hands-on experience. But yeah, that's a way to start.
Okay, great. I think we have gone through all the questions. So yeah, I don't think there's any more questions. Isa, if you have anything.
Perfect. Thank you so much. So that looks like that's all the questions we have today. Dr. Jayakumar, thank you so much for joining. That was an extremely unique and informative session. And I also want to thank our audience for joining today. If you have any questions, please make sure to reach out to Dr. Jayakumar through our Instagram. But on that note, thank you everyone for joining, and I hope you all have a great rest of your day.
Thank you, guys. Thank you.